Syndrome of internal iliac artery occlusion is manifested by absent pulse at the dorsalis pedis artery, intermittent claudication. The most common cause of peripheral limb ischemia in India is atherosclerosis. Lumbar sympathectomy is of value in the management of distal ischemia affecting the skin of the toes. The most common cause of acquired arteriovenous fistula is penetrating trauma. Etiopathogenesis of diabetic foot include the following except myelopathy. So it includes osteoarthropathy, microangiopathy and infection. Fogarty's catheter is used for removal of embolus from blood vessels. Pseudoaneurysms in IV drug abusers seen commonly in femoral artery. Treatment of femoral artery aneurysm is ultrasound guided compression of the neck of aneurysm, thrombin injection, and bypass graft repair. Which one of the following is not a symptom of atherosclerotic occlusive disease at the bifurcation of aorta? Lerich syndrome, gangrene localized to the feet. A young male presents with dyspnea, bleeding, and petechial hemorrhage in the chest after 2 days following fracture shaft of the femur right side. Most likely the cause is fat embolism. Aortic transection true about, most commonly associated with deceleration injury, high mortality, surgery definitive treatment, and aortography is the gold standard. Pseudoaneurysm in IV drug abuser is commonly found in radial artery, brachial artery, and femoral artery. Acute vascular ischemia manifests as pulselessness, paralysis, anesthesia, and coolness. A drug abuser developed pseudoaneurysm. Which of the following is should include in the treatment modalities? Ligation of involved vessel and wide surgical debridement. Most common site of peripheral aneurysm is popliteal artery. The Hunterian ligature operation is performed for aneurysm. Popliteal artery pulsations are difficult to feel because it is not superficial and does not cross prominent bone. Intermittent claudication is defined as pain in muscle on exercise only. A patient with critical lower limb ischemia presents with rest pain and ischemic ulcers. Lumbar sympathectomy is of value in the management of distal ischemia affecting the skin of the toes. Sympathectomy is indicated in all of the following conditions except anhidrosis. So, in which condition sympathectomy is indicated? In ischemic ulcer, intermittent claudication, and acrocyanosis. Pseudoclaudication is caused by lumbar canal stenosis. Best material for below inguinal arterial graft is saphenous vein graft upside down. Commonest part of subclavian artery to be affected by stenosis is first part. The most common site of rupture of abdominal aortic aneurysm is laterally into the left retroperitoneum. True about Kasabach syndrome is coagulopathy occurs and due to complication of hemangioma, thrombocytopenia is present. Most common artery involved in pancreatic pseudoaneurysm, splenic artery. Most common cause of abdominal aortic aneurysm, atherosclerosis. The deficiency of all of the following factor increase the incidence of thrombus formation except lipoprotein A. So deficiency of protein C, antithrombin 3 and protein S increases the incidence of thrombus formation. A patient presents with claudication in both buttocks and has impotency. The clinical examination reveals bruit over lower abdomen. What is the clinical diagnosis? Aortoiliac occlusion. The normal ankle brachial plexus index ABPI is 1.0. A value of 0.8 suggests some degree of arterial obstruction. True about ischemic rest pain, more in night, most common in calf muscle, increase upon elevation of limb, relieved by dependent position, often associated with trophic changes. All are true about intermittent claudication except that pain is positional. So it is most common in calf muscle. Atherosclerosis is important predisposing factor and relieved by rest. True regarding management of diabetic foot is venous system is commonly involved. When a patient suffers from critical limb ischemia, the ankle brachial pressure index (ABPI) is less than zero point 0.3, which is not true about femoral artery cannulation. Single wall puncture is indicated in those with normal coagulation profile is incorrect. Common femoral artery is cannulated. Femoral artery is catheterized at medial third of femoral head. Seldinger technique is used for both for femoral artery and vein. For doing CABC, Allen test is done to test which vessel, radial artery. Now, amputation, reimplantation time for lower limb is 8 hours. Stump pain is relieved by none of these. For replantation surgery, the detached digit or limb is best preserved in cold isotonic saline. During reconstruction of an amputated limb, which of the following is done first? Fixation of the bone is done first. Venous disorders. Earliest sign of deep vein thrombosis is calf tenderness. Injection sclerotherapy for varicose vein is by using ethanolamine oleate. White leg is due to deep femoral vein thrombosis. All of the following are seen in deep vein thrombosis except claudication. So pain, discoloration and swelling is seen in deep vein thrombosis. The following is the commonest site for venous ulcer, lower one-third leg and ankle. The most important perforator of the lower limb is between long saphenous vein and femoral vein. Pulsating varicose vein in a young adult is due to arteriovenous fistula, which is not used in treatment of superficial venous thrombosis, immediate anticoagulation, and rest and elevation. Most common complication of varicose vein stripping is ecchymosis. An operated case of varicose vein has a recurrence rate of about 10%. What is acceptable in the management of femoral vein thrombosis? Bed rest and spiral elastic bandages, thrombectomy. Operations for varicose vein are best accomplished by stripping. A 60 years old male has been operated for carcinoma of cecum and right hemicolectomy has been done. On the fourth post-operative day, the patient develops fever and pain in the leg. The most important clinical entity one should look for it is deep vein thrombosis. All of the following may be predisposing factors for deep vein thrombosis except sickle cell anemia. So, which are the predisposing factors? Oral contraceptives, nephrotic syndrome, and thrombocytosis. The duration of heparin therapy in deep vein thrombosis is 7 to 10 days. Cocket and Dodd operation is for subfacial ligation. In obstruction of inferior vena cava, there is prominent thoracoepigastric vein. Most common site for venous thrombosis is soleal vein. Deep vein thrombosis is caused by all except subungual melanoma. So it is caused by lower limb trauma, hip and pelvic surgery, Cushing syndrome. Which of the following test is used to detect perforator incompetency in varicose? Trendelenburg test. The deficiency of all of the following factors increase the incidence of thrombus formation except lipoprotein A. So protein C, antithrombin 3 and protein S increases the incidence of thrombus formation. The most common vein to get thrombosed is the posterior tibial. Brody Trendelenburg test demonstrates saphenofemoral incompetence. An intern was doing saphenous cannulation for a burn patient, then the patient developed sudden onset of pain along the medial border of the corresponding foot. Which nerve must have been accidentally ligated? Saphenous nerve. In DVT, all are seen except high fever. So, in DVT, increased temperature at site, pain, and tenderness is seen. An obese patient develops acute edematous lower limb following a pelvic surgery. Deep vein thrombosis is suspected. The most useful investigation in this case would be Doppler imaging. In a patient on anticoagulant therapy, the INR is maintained at 2.5 to 3.5 times the normal. In diabetic ulcer, following site is involved: heel, head of metatarsal, tips of toes. For prophylaxis of deep vein thrombosis, used is heparin, which is true regarding Trendelenburg operation, flush ligation of the superficial varicose vein, For which of the following venous abnormality is surgery indicated? Deep vein incompetence with DVT and varicosity more than 3 cm. Migratory thrombophlebitis is seen most commonly with pancreatic carcinoma. Brody Trendelenburg test is positive in saphenofemoral incompetence. Varicose vein is seen in DVT, AV fistula, prolonged standing, and obesity. Gold standard diagnostic test in varicose vein is duplex imaging. The initial therapy of documented deep vein thrombosis in a post-operative case is intravenous heparin therapy. Which one of the following reagent is not used as sclerosant in the treatment of bleeding varices? Ethyl alcohol is not used. Ethanolamine oleate, phenol, and sodium moruate is used. Site of diabetic for ulcer is heel, head of metatarsal, and head of toes. Which of the following statement is true regarding fat embolism? Most patients with major trauma involving long bone have urinary fat globules. Which of the following is true about varicocele except asymptomatic cases require surgery is incorrect? What is correct? Incompetent walls of testicular vein are responsible for varicocele. 90% are on left side. Femoral catheterization with spermatic vein ablation is done in recurrence. Which one of the following is the investigation of choice for suspected deep vein thrombosis of the lower extremity? Duplex ultrasonography. With reference to varicocele, which one of the following is not true of it? Varicosity of cremasteric vein is not true of varicocele. Left side is affected, usually feels like a bag of worms and may lead to infertility. All are done for a case of deep vein thrombosis except bed rest. So what is done in DVT? Thrombolytic therapy, bandage, and heparin. Cocket and Dodds operation is performed in which of the following? Subfacial ligation. Which of the following conditions disappear spontaneously in first year of life? Salmon patch disappear in first year of life. The most common cause of superficial thrombophlebitis is intravenous catheters or infusions. SEPS is a procedure used for veins. Under normal conditions, venous refilling occurring through arterial inflow alone takes 20 to 30 seconds when the limb at rest. Trendelenburg's operation is done for primary varicose vein. True about venous ulcer, always examine deep venous system. Biopsy should be taken from chronic ulcer associated with Klippel-Trenaunay syndrome. Match the list, name of the perforator and site of perforator. So Boyd's is below the knee, Dodds in the mid thigh, Cockett's above the ankle, and Basie's 1.5 centimeter above the calcaneus. Malignant cell in Hodgkin's lymphoma is Reed-Sternberg cell. Chronic lymphedema predisposes to all except Marjolin ulcer. So chronic lymphedema predisposes to lymphangiosarcoma, recurrent infection, and thickening of skin. Commonest cause of unilateral pedal edema in India is filariasis. All are true about congenital lymphedema except none of these. So all are true about congenital lymphedema. It is bilateral, involve lower limb, and almost always manifest before puberty. Acute lymphangitis may occur. The commonest cause for lymphedema of upper limb is filariasis. Milroy's disease is congenital lymphedema. Investigation of choice in detecting small para-aortic lymph node is CT scan. Milroy's disease is lymphedema which is familial.